Hi there, everybody. Happy Tuesday. It is Dr. Christine Anderson here, Los Angeles chiropractor for 30 years, 30 plus now. And tonight I'm here to talk specifically about the cervical spine or the neck and how to keep it healthy. So we're going to dive right in. I talked about posture in general last week, and I had a bit of a snafu, but I've got the link you'll see on my channel here from last week. It says optimal posture, but I have the link to another channel I have, so I'm sorry about that. I still have to figure out how I can fix it, but in the meantime, here we go. So during that episode on posture, I talked a little bit about spinal development, and that in the neck, that development occurs around 3 months of life after we're born, because we're born in a C shape, and then the first thing to develop is this neck lordotic curve. So we keep the C-shaped part in our mid-back. So I'm going to dive into a little bit of the structure of the neck because it's important. Structure dictates function, and then with function, if there's any alterations to the function, that's where you start getting dysfunction, disease, and then possibly symptoms. So there's a whole thing with that. You've got 7 cervical or neck vertebrae. So see 1, 2, 3, 4, 5, 6, 7. And notice the 7th one here. It's pretty prominent. It's actually called vertebral prominence. And this is the one that people will notice like they have a hump in their back, and we're going to talk about that. This first cervical vertebra is C1, and that is the axis. And I'm going to try and peel away the skull here. And this is the one that our skull sits on top of, and it gives us the nodding motion. The second one is called the atlas, and it's really, really going to be hard to see this one, but there's a little single point of bone that the first vertebra rotates on, and it is called axis and atlas. Those are the two, and that's going to be our rotation. No motion, right? So yes and no. And then we've got the back of the head or the occiput. And that really, those first 3 things in the spine can sort of create a dynamic motion there and can also create problems if there's anything going on, as I'll talk later on. What you're also going to notice are these red things going up in actually holes in the vertebra. And that's the vertebral artery. So that brings blood up into the skull. Super important. And then you see these yellow things right here. Those are the spinal nerves. Those are going to exit the neck and go a little bit up to the head. There's also cranial nerves that are coming off our brainstem above the spinal cord. But there's a few nerves that stay up at the top of the neck and the bottom of the head. But most of them are going to be going out, down, crossing the chest here, and out to the arm and hand. And that bundle together is called the brachial plexus, brachial meaning arm. So one of the key things with the spine, with the cervical spine, and problems that can kind of go along with it is the head. Now, I've just got the occiput here. Hopefully we've got a whole skull attached, right? Don't just walk around with the occiput. But it weighs a lot. So you've got a thing that weighs about 10 pounds on this little skinny stalk, and then it's got another solid part here. So this is kind of like a bobblehead, right? We can kind of move it in all directions. It has a lot of mobility. And in the spine and in the body, the more mobility you have, the less stability you're going to have. And this is why it's more vulnerable to acute injuries like whiplash and falls. And not only that, but chronic injuries due to improper posture. So let's talk a little bit about pain. And when I talk about pain, here's the thing. Pain, the absence of pain doesn't mean there's a problem. I'm going to say that again. Just because you do not have pain doesn't mean you don't have spinal issues. And this is a hard thing to wrap our brain around because we're sort of like no pain, no gain. If there's a problem, if there's no problem, don't mess with it. And when it comes to the spine, that can be dangerous because there can be things brewing that all of a sudden will become an acute problem that maybe could have been taken care of if you had gone to get your spinal checkups. So I liken this to dental checkups, right? We don't go into the dentist when we have pain. We go in for regular checkups. We want to make sure there's no cavities, we want to make sure there's no issues with our gums and etc. We don't wait till we're having so much pain to go in, or we shouldn't, right? We should be going in on a regular basis for our dental health. Well, same thing for your spinal health. And we're used to doing this for the teeth, but it's a new concept for the rest of our system. Because the more you are being proactive about your spinal health, then the less problems will just suddenly creep up on you, unless you've had some sort of injury. So it's the tip of the iceberg. You don't want to wait till you go surface above water. You want to come in, and the best time to go in actually and see a chiropractor is when you actually have no pain or problems. Believe it or not, that is like the best time. So neck pain causes globally about 27 to 48% of causes of pain in the world. And typically it might be due to something like acute trauma, like a car accident, a sports injury, a fall, or even maybe sleeping wrong. Then there's chronic stress we put on our spine with posture. And go back to last week because I talk all about this. As you're sitting at your computer, as you are texting, I forgot to grab my phone for the demonstration of text neck. But how you are holding yourself is going to determine where that head placement is. So it's 10 pounds when it's sitting properly up over your shoulders. But if the position of the head changes, and most of us are having that forward head posture, it's going to make your head heavier and heavier and put more stress on your neck structures. That. I also want to talk about one other trauma, birth trauma. So we don't normally think of this with the neck, but it's super important because it's how we start off in life, right? So normally, I'm just gonna grab my little baby doll here. Hello. So I'm gonna grab my pelvis too. Now, this is not gonna be a perfect fit, but you'll get the idea. In a pregnant woman, the baby should be facing this way. The back of the head should be facing the front and the spine should be facing the back. Okay, so kind of like this. If that doesn't happen, if the back of the head is facing forward, or let's just say the baby's head is turned one side or the other, or let's just say he should be in a little flex position. Let's just say the head is extended. That's going to affect how the neck is lined up as the baby is coming down in the pelvis and basically using their head as a battering ram. It's, look, I've done it 3 times. So it's intense, right? It's intense. So that's just if everything is going properly. You want that optimal alignment. And believe it or not, that optimal alignment of the baby has to do with the optimal alignment of the mom, which we'll get into the pelvis. And I don't know when I'm doing that, but it'll be somewhere down the line as I make my way down the spine. So we'll talk all about pelvic alignment. So the other aspect to this is actually modern obstetrics places a lot of stress and strain on the structures of the neck and sometimes even of the head when the baby is being born, because they are trying to assist the baby. So as the baby comes out, so the head comes out, and they place their hands on the head because they're going to try and turn the head so the shoulders can be born, and then they're going to try to pull down for that shoulder to come out. So it can be quite a lot of pressure on the neck structures. And believe it or not, it only takes about 120 pounds of pressure to sever a baby's spinal cord. And doctors are often applying about that amount as they twist and pull on the head in an attempt to help the baby be born. Then you add forceps and possibly vacuum assist, and that's going to increase the risk of damage to the spine, the spinal cord, the nerves, the dura surrounding the brain and spinal cord, and also that brachial plexus. So these are things I see in my practice every single day, ranging in severity, but this is how it happens, just so you kind of understand that. So most of us are being born already with some birth trauma. What's really interesting is that nature's provided babies with everything they need to be born without any assistance. It's naturally wired in there to, as they come out, they're going to actually turn their head, turn their shoulder, and be able to get their shoulders out all by themselves. Now, 1 in 3 people, and that might even be low, end up being born by C-section or cesarean section. And you might think, well, you're not pulling on the head, so that's going to be easier. But unfortunately, it's not, because a lot of times C-sections are done if the baby is in distress. The head might already be engaged in the pelvis, and they've got to twist the head out before they can actually get the baby out. And like uncorking a bottle of wine, right? And people think that this is a nice sort of clean procedure, but there's a lot of pulling, and the uterus is muscular, so you've got to get in there and pull it open and get the baby and sort of yank whatever you can and get it out. And if the baby wasn't coming out easily in the first place, there might be some reason why they were stuck. So anyways, I won't talk about this for too much longer, but babies who cry a lot and don't want to be put down might be telling you that they have pain or discomfort. That's the only way they can do it. Other signs that there might be trauma to the neck or other parts of the spine, like the shoulders. Sometimes the shoulders have an issue. They might go out of place or sometimes even be broken at the clavicle. Is if they are having breastfeeding issues, digestive or respiratory issues, if they're floppy or have hypotonia, so you go and hold your baby up under their arms, even if they're newborn, they should have a little bit of tone to them. They shouldn't just like slip through your hands like like really super floppy. The inability to turn their head, that might be damage to their sternocleidomastoid muscle, which, or they may have torticollis and it's turned one way and they can't turn the other. They might resist the use of their limbs. You go try to lift their arm up to put it in their nightie and they don't want to do that. They like resist you. So arms in this particular instance. And when babies hold their hands in fists at rest, that means there's tension somewhere. And if they put the thumbs in, that tension and compression is most likely here at the back of the head where the brainstem is. So this is kind of what I do as a pediatric chiropractor. This is the kind of stuff I help babies with every single day, and it's amazing. That way they start life off right, because, if that's not happening, then that's going to be another strike against our spines as we grow up. It's going to be less resistant to traumas. All right, so let's go into things like whiplash. And during car accidents, what tends to happen, I'm going to use the baby again, even though they're going to be sitting rear facing, so hopefully this won't happen to them. But generally, depending on which way you're hit, from the rear or from the front, if you're going to put your head towards the side that you're getting hit to. So it'll go forward and back. And when you go into those extreme motions, it actually starts to tear away at the ligaments, which are the supporting structures of the neck. And again, remember, this is a very mobile area, so there's a lot of movement. That's why things like headrests stop the movement somewhat, instead of your head going all the way back like in the past. before they started putting headrests in the cars. So this might cause pain, sometimes a lot of pain, and it's not necessarily equivalent to how big the accident is. Sometimes a very small jolt will create damage, so it's not this direct relationship. And when the ligaments get loose and there's a lot of tearing going on with them, then this is when you might feel like you can't hold your head up. And so this is when I give patients a cervical collar. You might also get brachial plexus damage. So you might have arm or shoulder symptoms or wrist symptoms, numbness, weakness, or referred pain. And if your head goes back too far, you're going to compress back there. And so that's another instance where you might have headache along with any neck pain. The biggest thing that happens is reversing or straightening the neck curve as a result of this damage. And this can be one of the reasons for poor posture in the neck. So we've got this nice lordotic curve. And if you damage it, usually it's down lower in the spine, it can straighten, or it can actually even go the other way. That is not going to be good because your head is going to be held forward of the body. Your ligaments are going to be stressed, your joints, your bones, your nerves, your spinal cord. The muscles certainly are going to take the brunt of it. And for sure, you're going to have some sort of discomfort. It would be strange if you didn't. If you don't correct it, if you don't see someone to help get the stress off of your neck and help with trying to get some of that curve back in, then you can most likely, I mean, this is just it. The most likely effect is that you're going to have degeneration of the disc, joints, vertebra, because the neck isn't going to move properly. And you might get herniated or bulging discs. And that's where the inner part of the disc kind of leaks out. So I'm going to show you this chart of spinal degeneration. It's in the lumbar spine in these models, but the same thing would apply to the neck. So here is a healthy lumbar spine. So you've got the vertebra, you've got the discs, and you've got a nice fat, juicy nerve coming off between. Phase 1 of degeneration, where you might just begin to have a loss of a curve or some other chronic stress. You get a skinnier disc there, which means there's not going to be as much room for that nerve to come out, but you'll probably maintain motion. So this is a good time to catch things at that phase 1. Phase 2, you start to actually get bony degeneration. You see this lipping and spurring of the bone. You see a way decreased joint space, and there's going to be less space for the nerve, and it starts to atrophy. So what that means is that as that actual physical pressure gets on the nerve, and it only takes about the weight of a dime for those cells to start dying, and we don't get nerve cells back. Once they go, they're gone, right? And it only takes about 2 weeks too. It doesn't take very long. So whatever that nerve goes out to, that's not going to function as well. So if it's in the neck and it's going out to structures in the arms and shoulders, you might notice some weakness or numbness and tingling again. This is where we definitely do not want to be, which is the last phase of degeneration, where you have complete fusion of the bones, basically no disc space left there. And that nerve is atrophied to like nothing. It's a little spindly nothing. So if you notice the difference between here is the healthy, and this is the last phase of degeneration, what happens to those nerves? So whatever that nerve is going out to is going to look the same. It's going to be atrophied. That our bodies require that nerve input to be able to function at an optimal high level. So that is sort of the progression. And for the most part, we can heal our bodies. We have a process of modeling and repair, breaking down and building up. But once you get to a certain point, so once you get to around here, it's going to be way difficult to do that, right? Especially if you get here. So this is, again, why it's so important to come in on a regular basis so that you're taking care of your spine all the way along and not waiting till it gets so bad. Now, if you're looking at an x-ray for degeneration, you might not see that for about 15 years. That's how long it takes for that bone to build up. So just know that the best thing to do is that proactive treatments. And then if you have a major car accident, fall, sports injuries, you just get in right away. And you might need to come in a few times in a row quite intensely, but that's because we've got to get the healing process going. All right. So what the result is of things like whiplash and chronic poor posture, especially text neck. I can never say this word, text neck. So I'm just going to pretend like this is a phone because I forgot to grab mine. This is a walnut and cellulose scrubber sponge. So let's just say I'm here on my cell phone and I'm looking down like this all the time. I mean, even doing it for just 2 seconds here is creating, I can feel the stress going on in my neck. So if you lean the head 15 degrees forward, the head weight is going to be 27 pounds instead of 10. With a 30-degree tilt, it's going to be 40 pounds. 45 degree, it's going to be 49 pounds. And if you're hunched over at a 60-degree angle, looking at that device, which is what most people I see people do, it's going to put 60 pounds of strain on your neck instead of 10 pounds. So just think about what that does over time. It's just too much weight and it's too much stress on the structures. Muscles are not meant to stabilize your spine. They're meant to move it. So when you have to recruit them to hold your head in that posture over time, they're going to give up. You're going to have pain. You're going to have tension. And that feedback loop is going to propagate that poor posture because your brain, if you're in that posture all the time, your brain goes, oh, this is how it's supposed to be. This is what we're doing now. And it keeps doing more of it. And so over time, it just, it becomes a very bad habit. And then if you are having too much of that forward head posture, you're going from here to here, and look what happens. This sticks out more. That vertebra prominence sticks out, and people are like, why do I have this hump back here? I don't want that hump. And I'm like, well, you're going to have to put some work into it and change your habits, because if you don't change your neck posture, that is not going to change no matter what. All right. So let's talk a little bit about chiropractic, because this is where it gets a little tricky. Chiropractic is going to help promote the proper movement and biomechanics of your spine and your neck and the rest of your body. And then when your spine is aligned and you can move properly, then the stress is removed from everything, muscles, joints, nerves, discs. And also, when that interference is removed from the nervous system, those nerves coming off in between, then you're going to get the optimal feedback back and forth from your brain. So then the brain will pick up those messages like, oh, this is where we're supposed to be in alignment, and start to propagate those good postural habits. It can help prevent degeneration because it's restoring that motion, and it can help you withstand any further traumatic stressors, like I mentioned, so that you're going to be able to withstand anything that comes at you. It's like the best time to get in an accident is actually like right after your adjustment, believe it or not. So I just want to digress a second here and talk a little bit about people who crack their back, self-adjusting or self-cracking, and they come in and they're like pushing their head over and, you know, moving it and cracking it intentionally, right? So that's the only time I ever want to hear crack your back, because what I do is I'm doing specific spinal adjustments and I'm very intentional. But when people are self-cracking, what they're doing is creating more instability, which can lead to degeneration. You're just moving vertebrae that are already moving too much in their range of motion. And typically this is because a vertebra above or below them is not moving properly. It's stuck. It's stuck out of motion so that the one above or below has to compensate. And a lot of pressure builds up there. So you feel that pressure, and that self-cracking releases that pressure. But 2 seconds later, you got to do it again and again and again. And each time you do that, you keep propagating that potential damage. So this is why chiropractic is helpful. When patients come in who are self-cracking and I adjust them, I'm working on the vertebrae that are fixed out of place. And I tell them, if you do not crack your own neck, then this feeling will go away within 2 weeks. And I have not been wrong yet because we're restoring proper biomechanics. But as far as restoring the neck curve, here's the limitation, all right? Adjustments themselves cannot get that curve back. There was some outside force that created that loss of the curve, whether it be traumatic or you doing some posture over and over and over again. So something was done to lose the curve. So you've got to do something more to get the curve back. So some of the things I've found to be effective are lifestyle changes, such as proper ergonomics, sitting at your computer, exercises which help retrain your brain, proper pillow support, and a specific type of device that I'm going to show you. So the first thing I want to show you is the eyeglass exercise. This is super easy, super inexpensive. I just grabbed my sunglasses because I forgot to bring the ones I use at my office. But hey, yeah. You tape off at least half of the glasses so that in order to see straight ahead without having the paper be in the way, I have to lift my head up and bring it back. So it brings the head more in alignment of the ear over the shoulder. You can cheat and go like this, but don't do that. It doesn't feel good either. That's it. 20 minutes a day, at least. You can do it while you're working on the computer. You don't need the actual glass part in there, so you can just pop the glass part out if it's sunglasses, or get some clear regular glasses, or put it on your prescription glasses. It doesn't matter. The point being that you want to retrain yourself, so at least 20 minutes a day, more if you can. And when I go walking, I don't necessarily put the paper there, but I pretend like the paper is there so that everything kind of follows. I've already put a series of Post Isometric neck stretches and exercises on my page, so I'm going to find it and put a link to it in the description so we don't have to spend time here. But though that is some of the best stuff that you can do as far as exercises go and releasing stress and tension too. I talked a little bit about pillows last week, so you can refer to that for more, but sleeping on your back is best with a pillow supporting your natural curve. So in other words, when you lay down, you want your chin slightly elevated so that you can get that curve back in. You want to retrain it. This is passive, but it's still quite effective. And you're also not doing any weird postures while you're sleeping to propagate that negative posture. And everyone is different. So there's not like one type of pillow that fits everybody, which is why I have a myriad of pillows at my office that I then try out on patients just to make sure that the size is right, the style is right, and that it's comfortable. Sometimes when you first start using a cervical pillow, if you have a flattened neck curve or reverse curve, it's not going to feel very comfortable to lay too long with your head back. So I will do things like the dip in the pillow. I'll have people fill in with some washcloths or a towel or something folded up. And then as they get used to it, they can peel those away. Or use the pillow as is in the beginning of the night. And if it becomes uncomfortable, switch it out for another one so that they can kind of get used to it. All right, almost there. I'm going to talk a little bit about this device that fell when I picked my baby up. All right, this is called a posture pump. It is made in the USA if you're getting it from the company. I warn you, there's some cheap knockoffs out there from China that say posture pump and you get them and they are not. So I recommend either getting it from me or the posture pump website. So what this does, it's a very simple device, and actually the new one doesn't have a chin strap. So this is where the head goes. This goes over the forehead. And this, I've had this for a very long time. This goes over the chin. They've done away with the chin part. But this part here is the part that matters. This is the one that your neck goes on. and you're going to pump this up. There's a little bulb here that you pump up. I don't know if you can see that. It's growing. And then I can release the air. So there's a series that you would do for the treatment. This applies an incremental upward pressure on the back of the cervical spine to try and get it back into that lordotic position. So it also, when you're creating the tension and releasing it, it creates a milking type of action, which can also help with things like herniated discs. So trying to like pull that disc back in. It lubricates the joints and keeps them moving properly and has a decompression effect on the nerves. So there's a lot of powerful evidence that they have done in the form of MRI images before and after treatment that supports this effect and the changes that can occur. And they've done some studies that I will post in the description so you can read them. And I prefer this. They call it an expanded ellipsoidal decompression rather than typical linear traction that you might see where somebody's hanging it over a door or they're laying flat and they put like a little pillow under their neck and then they're pulling their head back the other way. These are more passive ways to traction. And from what I've seen with the comparative study with the posture pump is that these can actually not only not help get the curve back, but actually sometimes make it worse. So I've had really good results with this simple, effective device. And it's about $200, but it's something that you would purchase yourself and use at home at least 3 times a week, more often if you're trying to facilitate those changes a little quicker. So that's about it. I'm done for the day as far as talking about the neck. I hope you found this super helpful. If you're out there and you have a question, you can type it quick as I'm wrapping up. Next week, we're moving on down the spine. I believe it's upper back, chest, and the top part of the shoulders. So I'll have some great things for you then. And if you have something you want to hear me talk about, just let me know. I'll put my contact information in the description. If you like this, give me some thumbs up. Share with your friends and family so that they too can have good neck spinal health. And subscribe if you want to know when I'm posting, because I will be putting up more exercises as we go through this portion I'm doing on having an optimal health and optimal life. All right, everybody, I hope you have a great week. And until next Tuesday, I'm signing off. Bye.